and calcaneus, correct?
Yeah.
Mhm.
And then we talked about ankle. So anytime you're doing foot, ankle, anything lower extremity, in theory, shoe and sock has to come off, right? Pants, when we start getting to tib, fib, and knee, I will tell you that I think pants should come off, because even if they roll them up, when you've seen how digital is, right? Like it gets every nook and cranny, every little fat roll, every little crease in clothing. So if you scrunch up the pants and you have it, it's gonna show that. But it seems to be that out in the field, they're not really changing. They're changing patients as least as possible, but I think that's a time factor. Like they're wanting, especially at Ormond and DeLand, they're wanting to go, 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 go. So it's less changing. But me personally, I'm gonna tell you, the more you change, the more you have like bare skin or the skin right on there, it's better, and there's not as much artifact from clothing and stuff like that. But when we do foot, calcaneus, ankle, shoe, and sock have to come off. When we talk about tib fib later, like I said, it's a long bone, so you have to get both joints. So if their pant leg can come well above their knee, that's fine, but if not, you'd need to remove it. Jeans show up, any kind of thick material will definitely show. You don't want that obscuring any of the anatomy. And then the other thing, we're gonna do ankle on the table, just like we did foot. But how did I say yesterday most lower extremities in the field are to be done?
Weight bearing.
Weight bearing, absolutely. That is ideally how they should be done, is weight bearing. That seems to be the push for protocol. The only time they're not weight bearing is if what? Trauma, or the patient doesn't walk in.
If they come in, yeah.
If they don't walk in on it, then you're not gonna, their foot's not gonna be hanging off to the side and, oh, sorry, we gotta do weight bearing, stand up on it. That doesn't cut it. But ideally, most lower extremities are done weight bearing, and you told me yesterday it's ideally to see the joint under pressure or under stress, correct?
Mm-hmm.
Okay. So ankle is how many views? 3 views. What's one of them? AP. What's the other easy one?
Lateral.
Lateral. And what's the third one?
The
It
10,
is a medial oblique. How many degrees?
10 to 15? 15.
15 to 20 degree medial oblique. And what is it to demonstrate? What's the whole purpose of that oblique? To demonstrate the...
Starts with an M.
Does start with an M. Mortise joint. Thanks, Eliana. To demonstrate the Mortise joint on that. And then when we did calcaneus, how many views on a calcaneus? 2. What are they? What's the easy one? Lateral. What's the other one?
Dorsal. Plantar dorsal.
Planto, dorsal,
Axial.
axial. How many degrees? How many? 10. Nope. Huh?
30.
Nope.
40.
40 degrees cephalic, or towards the ankle. So planto, dorsal, axial, and a lateral. What kind of lateral?
For what?
Medial lateral.
Foot, calcaneus,
Medial lateral.
medial lateral, correct. Can you do lateral medial?
Yes.
You can.
It'd be really hard though.
Yeah, really awkward on
uncomfortable.
the patient. How many views on a foot? 3. What are they? AP?
Medial lateral. 45. Or no.
Okay, well, degree first. 45 degree.
Medial.
Actually, no, on the foot it's not 45. Is it?
Mm-hmm. I think.
Isn't it 30 to 40?
Yeah.
Oh, 30, 40.
30 to 40. 30 to 40 medial oblique. Sorry, I was like, no, that doesn't sound right. 30 to 40 medial oblique, and the lateral, which is a medial lateral. Right.
Put you on my big screen in the house.
Do up.
I'm gonna put my phone up to my big screen and watch this.
Oh, great. All right, so let's do ankle. Who wants to be my patient?
Sean and
I'll go again. They will. It's too
You
cold
wanna be
for
my
me to take
patient?
my shoes on.
All right, come on.
You gonna show us your toes?
You
Hey,
won't.
look, man.
Show us your toes.
You won't.
Who won't? Who won't?
You see?
Who won't? Alright. Hold on, let me see. I'm walking out.
I just wanna take a shower.
Shirt off,
I smell
right?
like pound cigarettes.
All right, sir. Which ankle seems to be giving you issues?
My left one.
The left one. Do you want to take your shoe and sock off?
Yeah.
Do you need assistance?
No.
Should have said yeah.
Do they call them that?
It
If
is,
they need
what,
assistance?
yeah, I've had, wait, leave it on. I've had so many patients, especially putting it back on, where I'm tying their shoe, or little old people can't get their,
They can't bend that
can't
way.
get, right.
Anymore.
Oh, look at your clean socks.
Alright,
going
I'm gonna
with
let y'all
clean
know I ain't get
shoes.
my pedicure this weekend because I had some stuff. I had to
Nobody
take care.
cares,
I
yeah.
I had to watch the kids and all that. So I
He
couldn't
was
really-
planning on it.
I couldn't. Yeah, I was planning on.
I
I'm
need
taking
your
off my
sock
pedicure.
off.
We're so weird.
Less exposure possible.
But you don't want us to see your toes?
Toesies.
Aw, look at
They're
your
so
little foot.
cute.
Come on now, don't do all that. You ain't gotta. You going too far. Oh, man, I got man
When
feet.
you agree to be patient,
I
you
got
sit-
man feet.
Come on now.
I got man feet. Let me go get 2 14 size to fit this man foot.
I hope I just don't
Lay back
start
on the
smelling
back.
that man foot.
You ain't gonna smell it.
I'm not smelling nothing.
Okay,
Too early in the
so
morning.
when patients do this, remember we said yesterday it's easier if they lay on their back? And then did you see how it's not comfortable? So he tried to put his foot under,
Yeah.
but if he puts his foot under, it'll throw off. I'm sorry, am I interrupting?
I was
the
talking
hair
about
class?
foot. We were foot.
Foot.
I was talking about feet.
So you want them to
Those
lay
damn foots.
flat on their back, so that nothing is underneath that extremity. And then we can shield for all lower extremities, correct?
Yeah, I really do.
No,
Alright. You try
I'm
me.
not.
Don't,
I'm not.
please don't. Okay, so long axis of the part with the long axis of the IR, correct? And then ideally center of the part and the center of the IR.
Ticklish?
Is
Cold.
it ticklish?
No.
Oh, is it cold? Yeah, I'm sure it is. Now I do have it at 41. I know it should be at 40, but with this pad, I just went up a little bit because it should be flat on the table, but I wanted it to be more comfortable for my patient, so I didn't
You can do that for me.
take the pad off. Did you have the pad?
Yeah.
You had the pad.
Yeah, but it's at 40.
Oh, well, 5 points on. Alright, you can see by the lines I'm in the center. Remember I said to some of you that was your biggest struggle. You knew the position, you knew the technique, but you guys were fighting with the IR. But all you want to do is just lift up. I know that central ray is mid-malleoli, so I kind of want that right in the center, which you just lift them up, move this to wherever you need it, as long as the long axis is going with the long axis of his part. Press that down, toes back a little bit. Remember, this is the one where you want to make sure his leg is straight. And then collimation isn't like you would think for an ankle it would be really tight, but it's not. Remember we said we need distal 1/3 of tib fib.
How does that hang?
It hangs tib fib up. Alright. And left marker on the lateral aspect. Mid-malleoli, he's shielded. Alright, just like that for me. It's set at 64 at 2.1. Okay, so AP. Next comes the 15 to 20 degree medial oblique. So I'm just gonna move. You're fine. I'm gonna move his foot over just a smidge, and then we're gonna roll your whole leg in just like that. Whoa! I was like, man, that moved awful easy. All right, and we'll keep his toes back, and just a slight 15 to 20 degree angle, and this ideally opens that Mortise joint. Okay, just like that. Okay, you can relax. And one more.
Okay.
What we'll do is bend your knee for me. Bend your knee and let your leg fall out to the side. Sometimes you might have to turn their hips just a smidge. There you go. Good. Alright, and then toes up. Good, just like that. central ray is on medial malleolus. Toes are up on first surface. This is supposed to be at a 90-degree angle to his lower leg. Okay, good, just like that. Remember I said when you're shooting, just make sure that the shield is actually shielding, because if I leave it up like that, is that really doing any good?
No.
No, so you kind of want to tuck it down like that. Same technique.
You want more kids?
Good, okay,
You want more kids?
No.
you can relax. You don't? Why, they're so cute.
I know, but I'm good with the ones like the whole
One of
like
each
baby
flavor?
stage.
Yeah, it gets old.
Yeah, like he need to grow up already. You know
Aww.
what I'm saying? But for real, like
Okay.
No, he's so cute.
stay small for so long.
Not
I don't
really.
feel like
No,
that
no,
at
yeah,
all.
they get
You
that.
actually, when
No,
you let 'em
I don't
grow
think they
up.
stay small, huh?